IELTS Part 153. This test monitors brain waves, muscles tension, breathing, eye movement, and oxygen in the blood. Audio monitoring for snoring, gasping, and episodic waking is also done during a polysomnogram. Non-intrusive solution for treating sleep apnea involves simple lifestyle, and the simple lifestyle changes, of course. In many cases, symptoms of sleep apnea can be eliminated when patients try losing weight or abstaining from alcohol. People who sleep on their backs or stomachs often find that their symptoms disappear. If they try sleeping on their sides, sleep specialists also claim that sleeping pills interfere with the natural performance of throat and mouth muscles and suggest patients to do away with all sleep medication for a trial period. When these treatments prove unsuccessful, sleep apnea sufferers can be fitted with a CPAP mask, which is worn at night over the mouth and nose, similar to an oxygen mask. CPAP stands for Continuous Positive Airway Pressure. In extreme cases, especially when the facial deformities are the cause of sleep apnea, surgery is needed to make a clear passage for the air. Many different types of surgeries are available. The most common form of a surgery used to combat sleep apnea is an valvulopalatoplasty, IPPP. This procedure involves removing the uvula and the excess tissues around UPP, and the other half continue only. While the UPP helps about 50% of the patients who undergo the procedure, while the other half continue to rely on CPAP machine even after the surgery. Another type of the surgery called mandibular myotomy involves removing a piece of the jaw, adjusting the tongue by reattaching the tongue to a position about 10 millimeters forward. Air is able to flow more freely during sleep. This delicate procedure is performed only by the surgeons with expertise in facial surgery and is almost always successful in eliminating the air obstruction. The latest surgical procedures use radio frequencies to shrink the tissue around the tongue, throat, and soft palate. Reading passage 3. You should spend 20 minutes on question 28 to 40, which are based on reading passage 3. Reading passage 3. Adult intelligence. Over 90 years ago, Bennett and Simon delineated two different methods of assessing intelligence. These were the physiological method, which concentrates mostly on intellectual processes, such as memory and abstract reasoning, and the pedagogical method, which concentrates on assessing what an individual knows. The main concern of the Binet and Simon was to predict elementary school performance independently from the social and economic background of the individual students. As a result, they settled on the psychological method, and they spawned an intelligence assessment which has been substantially unchanged from the original test. With few exceptions, the development of adult intelligence assessment instruments proceeded along the same lines of Binet-Simon test. Nevertheless,